Thank you everybody for watching this. My name is Dr. Gabriel from Advanced Wellness Center. And tonight's topic we're going to be talking about neck and shoulder pain. So first thing I would like to talk about here is the spine. So the spine is 33 bones. They're all connected to each other and we do hold the back together. And what the spine does is that it provides protection and movement, blood supply, and absorption of impact in case we fall straight on an axial plane. So the spine is connected to each other by bones and by muscles. The muscles here are very complex and they hold the skull to the rest of the body and the rib cage in a very extended way, and that way we can actually be able to provide a lot of movements and be able to flex, bend, and twist the way we would like to do. So if we focus here on just the neck bones and the neck muscles, we see that the neck muscles can connect the skull to the shoulder blade and to the spine. The spine bones or the neck bones here have nerves that go outside and then they supply the rest of the body. So I'm sure some of you or all of us had some type of neck pain or shoulder pains at one point in their lives. So we will talk a little bit about neck pain here. What it does is that it can diminish the quality of life. It can require some time off of work. It can affect and produce loss of productivity and varies in intensity and in duration, providing the type of injury that you might sustain. So if you seek care within about 2 to 6 weeks, chiropractic care is usually very effective in the first 6 weeks after injury to get rid of the acute injury that you sustain. So neck pain here, what are the causes of neck pain? And why would we actually have neck pain? Sometimes we can get up in the morning and we're just slept wrong, and some other times it's more than that. So if we have some kind of a motor vehicle accident or some type of sports injury, that way we can actually sustain a lot of neck pain and shoulder pain that might affect us. Or if we have any type of slip and fall injury, that might be also another cause. So if we trip and or slip and fall right in an axial position, what happens is that sometimes we can have some type of a compression fracture, and that can cause some type of a pressure on the spinal cord, and it might cause some spinal cord injury. Talking about different types of neck pain, whether it's muscular, whether it is coming from the nerve or coming from the bone, coming from the joint, usually if the problem is muscular, we can be able to identify that and treat it effectively. If the problem is from the nerves, then usually the nerves here, as in this picture, the nerves are going to the skull, and what happens is that if there's any pressure on these nerves, then they might cause some type of a headache, which we call tension headache. But in actual fact, it's coming from some kind of a pressure on the nerves that are going outside of the neck bones. If the problem here is coming from the nerves that go out from the neck bones or from the disc, that might cause some pressure on the nerve, then through these nerves that go out to the arms and hands, then we might get some kind of radiating pain, which would be in the form of numbness, tingling, or shooting pain to the hands or the arms. If there is any kind of shoulder impingement on these nerves, then it might cause the similar effect or similar type of pain, because the same nerves that do supply the hands supply the shoulders, and if there's any kind of problem going on in the neck, then it might actually affect the shoulder as well. So here we can take a look at some of different types of pains that we might get from any type of impingement at the wrist or at the neck. So if there's a problem with the neck bones right here and they're affecting the nerves, then we might get similar type of pain to the pain that we get from carpal tunnel. Shoulder pains, on the other hand, could happen here on the posterior aspect of the shoulder or the back of the shoulder, or they can happen here at the front of the shoulder. So looking at the different structures of the shoulder joint has 18 different bones, 18 different muscles, and some of these muscles attach at different parts of the shoulder joint. And some of these muscles too wrap around in a certain way where we can get, as in this picture, we have the rotator cuff muscles here. They go around, and as you can see, they attach here on the anterior aspect or on the front of the humerus, which is the arm bone. If there's any kind of problem going on here with the shoulder muscles, then they might cause some type of pain on the back side of the shoulder or on the front side of the shoulder as well, depending on what the problem is. So here we're looking at different types of ligaments and tendons that are supporting the shoulder joint. And these ligaments should be attached, and there shouldn't be an decrease in space in between them. So here in this picture you see there is a lot of healthy tendons, healthy joints, healthy ligaments, and here if there is any kind of trauma that happens, that it might actually cause separation of these tendons or separation of these ligaments that are holding the joint together. And this usually happens if there is some type of motor vehicle accident while you're pushing this way on the steering wheel, then you might get some kind of separation there. So, another type of shoulder problem could be coming from trigger points, and usually these are very similar in a map-like fashion, so we can identify which trigger point is causing the shoulder pain and be able to treat that accordingly based on which type of treatment that we need to cover to get rid of this problem. So again, talking about all these problems, so what is the solution? What do we need to do? Do we need to go to the ER? Do we need to go to the primary care physician? Well, what you need to do is that you need to do some type of conservative treatment, and that way we need to go get your problems diagnosed. So if you go to your chiropractor, if you go to your primary care physician and ask for these symptoms, and then we'll be able to diagnose it and treat you accordingly. So I would recommend for you to slow down, stop the activities that increase your pain, and then go to your primary care physician to do a proper physical exam. So out of the physical exam that we did here, and the patient had headache plus neck pain, we'll be able to identify some kind of an occlusion going on in the arteries that are going up to the brain, and then we have to send this patient to an emergency room for surgery right away. So that's why a proper physical examination is really important if you have any kind of neck or headache or shoulder problem. So we do another type of investigation where we can take a look at x-rays, and we can see here different or various types of imaging. The first one, we have a straight neck here that we see on x-rays versus here there is an MRI of the neck that we were able to identify, which was really containing its curvature, and then you can see that it's a very healthy neck on this side versus what we call military neck on the right side here. Usually with x-rays we see bones, with MRIs we see more soft tissue, and we see other structures that we were not able to see on x-rays. So in this particular x-ray we were able to see that there was a total dislocation here between the neck bone and the bones that are here on the upper back. If there is any kind of compression fracture going on, then that would really affect the pressure on the spinal cord that we would see here. So here, this is the spinal cord. There shouldn't be any compression or any type of impingement on the spinal cord. And usually a treatment for that would be surgical treatment. We'll be able to do some type of saving to these joints and these bones. The treatment that provide here at Advanced Wellness Center would be really based on the severity and the causes of these symptoms. So we utilize chiropractic care and herbal medicine, and then we can refer for acupuncture injections, and we refer for surgery if necessary. So what we start doing is that we look at stabilization and immobilization to the structures that are really hurting, whether it's the neck, shoulder, low back. And then we utilize chiropractic spinal manipulation for joint dysfunction. And then we utilize muscle relaxation via massage and other types of modalities that we utilize. And then that way the muscles are relaxed, so we can start doing some exercising, and that way we can increase range of motion, increase stability to these bones, and be able to function properly. Part of our taping here is kinesio tape, and we provide nutritional consultation as well. So these are types of braces that we utilize here at Advanced Wellness Center. And I would like to talk about spinal manipulation, where it's a very common technique, and it actually returns the joint back to its mobility and formal position and function. And it's really effective within the first 2 to 6 weeks, and that way we can get the joints back into motion and be able to have you functioning well. These are some of the references that I have here, and if you have any questions, feel free to call us at 503-389-5545, or visit us on the web at www.pdx-chiro.com. Thank you very much.